Previously, we had talked on the ureter pelvic part, and we had talked on as the ureters cause the bifurcation of the common iliac artery. They pass over the pelvic rim, thus leaving the abdomen and entering the lesser pelvic. The pelvic parts of the ureters run on the lateral walls of the pelvic parallel to the anterior margin of the greater sciatic notch between the parietal pelvic and peritoneum and internal iliac arteries. Opposite and ischial spine. They curve anteromedially, superiorly to the levator hernia and enter the urinary bladder. The inferior ends of the ureters are surrounded by the venous plexus. So you're looking at the course as our main topic today. So the ureters pass obliquely through the vascular walls of the urinary bladder in an inframedial direction, entering the outer surface of the bladder approximately 5 centimeters apart, but their internal opening into the lumen of the empty bladder are separated by only half the distance. After a distance, this oblique passage through the bladder wall forms a one-way flap valve. The internal pressure of the filling bladder causing the intramural passage to collapse. In addition, contraction of the bladder musculature acts as a sphincter, preventing the reflux of urine into the ureters when the bladder contracts, increasing internal pressure during maturation. Urine passes down the ureters by means of peristaltic contractions, a few drops being transported at intervals of 12 to 20 seconds. In males, the only structure that passes between the ureter and peritoneum is the duct deferences. It crosses the ureter within the ureteric fold of the peritoneum. The ureter lies posterior to the duct deferens and enters the posterior superior angle of the bladder, just superior to the seminal glands. In females, the ureter passes medial to the origin of the uterine and continues to the level of ischial spine, where it is crossed superiorly by the uterine artery. It then passes close to the lateral part of the fornix of the vagina and enters the posterior superior angle of the bladder. We shall look at the arterial supply and venous drainage of the pelvic portion of the uterus. The arterial supply of the pelvic parts of the uterus is variable, with uterine branches extending from common iliac artery, intra-iliac and ovarian arteries. The uteric branches anastomose along the length of the ureter, forming a continuous blood supply. The most constant artery supplying the terminal parts of the ureter in females as branches of the uterine arteries. The source of similar branches in males are inferior vesical arteries. The venous drainage generally parallel arteries supply, draining to the veins with corresponding names, and then the lymphatic vessels pass to a common and internal iliac nodes. The intravenous, looking at the innervation of the ureters. The nerves to the ureters derive from adjacent autonomic plexus, the renal, aortic, superior and inferior hypogastric, efferent or pain fibers from the ureter follow sympathetic fibers in retrograde direction to reach the spinal ganglia and spinal cord segment of T10 to L2 or L3. So looking at the ureteric pain is usually referred to ipsilateral lower quadrant of the abdomen, especially to the groin regions. So the blood supply and intravenous of the ureter. Diagrams below show the blood supply and intravenous supply of the ureter. So in this case here, this side we have the anterior view of the left side. We have from the renal artery, glomerular gonadal artery, from abdominal aorta, from common iliac artery, from iliac artery, look from superior vascular artery, from uterine artery, that's a female, from rectal artery, and then from vaginal artery, and then from the inferior vascular artery. So this region here is called the pelvis, and then this is called the abdomen, as shown. Thank you for watching. Stay tuned. We love you so much, and thanks for listening to me. It has been again Dr. Derek representing to you the anatomy of the kidney. Stay tuned. Subscribe if you are new. We love you so much. Stay blessed.